So now I'm going to tell you about the lateral compartment of the leg and Peroneus longus, Peroneus brevis. Okay. Lateral compartment, the leg, Peroneus longus, Peroneus brevis, both of them innervated by superficial peroneal nerve. They pass behind the lateral malleolus, and then that's how they reach into the sole. Brevis inserts onto this, styloid process, the fifth metatarsal, and then this longus winds below this cuboidal tunnel and inserts onto the medial cuneiform and the first metatarsal at the base, at the same point where tibialis anterior gets inserted. This muscle, tibialis anterior. Between talus and fibula, the articular surface is triangular. Here it's a triangular articular surface. This actually helps you side determination of fibula. You must have seen this in the lower end of the fibula. And posteriorly, there's a groove on the lateral malleolus. Remember the groove on the posterior surface of lateral malleolus. You can see this is the groove here on the posterior surface of lateral malleolus. The two tendons passing below. The two tendons passing below the posterior surface of the lateral malleolus. The two tendons passing are Peroneus longus and brevis. Brevis will be above, longus will be below, right? So the lateral compartment muscles, not only the two muscles, the nerve supply is, remember, it's superficial peroneal nerve for the two muscles. The two muscles actually again cross to the two retinaculum. There are peroneal retinaculum, meaning like this. The first one is the complete band. The two tendons pass below the retinaculum. Then the lower tendon, lower retinaculum actually is splitted, so that because of the peroneal trochlea placed here on the lateral aspect of the calcaneum, there is a peroneal trochlea, and because of that, because of the peroneal trochlea, the inferior peroneal retinaculum actually is splitted, so the two tendons pass out separately. Got it? And then this Peroneus brevis, this will go and insert onto, can you see this? If you calculate this, there is bony prominence here. This bony prominence is the styloid process of the fifth metatarsal. So onto this styloid process, there is insertion of Peroneus brevis, right? So the prime action of the muscle of the lateral compartment of the leg is eversion. Eversion is elevating the lateral part of the foot, and such that the sole faces laterally. So that is the action of the two muscles. So Peroneus brevis will actually help in eversion of foot. And remember, sometimes during a forceful sudden eversion, there are chances of fracture of the styloid process of the fifth metatarsal, and that's called Jones fracture. Peroneus longus. Peroneus longus will pass because there is a peroneal trochlea here. Because of that, the inferior peroneal retinaculum is splitted, so Peroneus longus will pass out separately below and will wind behind below to this cuboid. There is a bone here, the cuboid, so it will groove the cuboid, and that's called cuboidal tunnel. Why? Because it's covered by a fascia, and that actually is fascia also, this tibialis posterior also helps in maintaining the tunnel. So this Peroneus longus, if they ask, when it reaches into the sole, it grooves the cuboid, and that passes through the cuboidal tunnel. Then after passing through that tunnel, this, I told you, Peroneus longus is the muscle of the deepest layer of the sole. That's the fourth layer, and it reaches here. And where will it will wind obliquely like this, right? So in doing so, it also helping maintaining the posterior transverse arch of the foot, and will insert here onto the same point onto which this tibialis anterior was inserted, and that is that at the base of the medial cuneiform and the proximal aspect of the plantar aspect of the base of the first metatarsal, laterally this Peroneus longus tendon will get inserted, and together the two tendons will form a sling, and it's a sling which is helping, it's like this. The sling is like this. These tendons will help you elevate your foot like this, right? It is helping elevating the foot like this. This is a sling, right? So what the advantage you're getting from this sling is that medial longitudinal arch is being maintained by this tibialis anterior, lateral longitudinal arch is being maintained by this Peroneus longus. Together the sling because it's, you know, when you are placing your foot in a loop of a string, right? So it will actually compress the tarsals bones. So what happens, it actually is helping the maintenance of the posterior transverse arch of the foot. Got it? Okay. So that was about the lateral compartment. The, you know, eversion is the prime action, and the nerve supply is Peroneus, superficial peroneal nerve. And remember, after supplying these two muscles, superficial peroneal nerve, it becomes cutaneous, and then it descends down into the front of leg, and then it supplies here the skin of the dorsum of the foot.